So we now have, I think, about 15 minutes for a few questions to be taken. But before we start, I think Sanjay wants to make one clarification. So maybe he could begin with that, and if in the meanwhile people could send in their questions.
Sorry, I just wanted to make a very quick clarification in light of what Professor Sood said, namely that the government discourse is that there has been no alternative. And I think I didn't speak to that point in the way I should have done. So just very quickly, if you look at the interregional comparison in the world, and you compare this WHO Southeast Asia region, which includes India, with the WHO Western Pacific region, which includes China, you'll see a massive difference in terms of both the cumulative deaths per million and also the GDP per capita growth. And essentially, China did very well, and the East Asian region as a whole, including countries such as Vietnam, did extremely well in both respects, having minimal cost, economic cost of addressing the disease and limiting the impact of the disease as compared to other world regions. And in particular, India, which drives the results in the Southeast Asia region and which did which had one of the worst adverse impacts on economic growth in 2020, really looks like a case of having paid a big price and not gotten very much from having paid that price, whereas China and other countries didn't pay much of a price in the end and also had better results. And that, of course, takes us to the question why, and in particular, the role of government in contact tracing and many other specific interventions, which they mobilized successfully to be able to undertake, and which India did not during the period of the lockdown. And that's the sense in which India wasted its effort by having it be much more general, insufficiently specific, insufficiently targeted, and insufficiently effective as compared to other countries, which is directly visible in this data. That's all I wanted to say. Thank you.
Thank you. If anyone has any questions, please, you can even raise your hands. I have a feeling people are tired after a long day. Okay, Judith has a question, please.
Judith, you're muted.
You're muted.
Okay. Okay. Can you hear me now?
Yes.
Okay, thank you. I really appreciated all that. I think this is a fantastic amount of really interesting material and ideas. Jayati, I wanted to just take you up on this shocking situation about the vaccines and the vaccine strategies and the vaccine situation generally. And just say, is there any chance, do you think, of getting any sort of lobbying, any sort of political mileage out of this to try to tackle it? Because I think it's not been nearly well enough discussed in the media, and certainly a lot of us, I think, haven't been alerted nearly well enough to this situation. But I'm just wondering how we could generate some sort of political momentum around the situation. Do you have any ideas on that?
Could I, respond? Yes, Judith,
yes, please.
I completely agree with you. You know, I'm currently in the US and I'm absolutely shocked that there is nothing in even the so-called liberal media. New York Times. There's just nothing even talking about this issue. If they're looking at inequality, they're saying, oh, it's not reaching Black people in so-and-so place, rather than that you're depriving the rest of the world. The issue of intellectual property in particular, I think, is completely inadequately understood in the North. There's just not enough public pressure. And there are some positive signs. A group of European parliamentarians, the Euro MPs, I think 120 of them, have written a letter, which is a very good letter, talking about the necessity for sharing technologies and for dispensing with the IPRs during the pandemic. Obviously, much more needs to be done. I really think the media has a significant role to play in this. It's been disastrous. At least the little that I can see, there's almost nothing. And the focus is really on the incompetence of governments for not appropriating more vaccines.
Yeah.
Rather than the other way around. And also the fact that these property rights are depriving the people in the north as well. I think that obvious lesson doesn't seem to have got incorporated. There are efforts, I think, by progressive people to make a noise about this, but I don't think it's got enough of public traction at all. And it's not something that is impossible to achieve. I mean, you could mobilize people writing to their MPs. You could do all kinds of things to just create the wider awareness. Because it's actually a disservice even to northern populations. It's really, it's just companies who are benefiting. Yeah.
I mean, if all the discussion here is about trying to scramble to get access for existing supply, there's no discussion of the fact that the demand is another part of the question, or the production is another part of the question.
I also just want to highlight, there is no evidence at all that the Chinese, Russian, or potentially Cuban vaccines are going to be any worse than these, the big three or the big four. And yet again, there is active suppression of the possibility of using these in Africa.
No, thank you. Shocking.
Vikas has a question.
Mic working?
It's working, but your voice is echoing a little.
I have a question to Sanjay and Jayati, who both talked about differences in the economic hit that the countries have had, and differences in what the countries, the extent to which the countries have been able to help people cope with things like lockdowns. I was wondering if you have something to say about the specific form of social, are there specific things that have worked? And what kind of social protection, what kind of support has been used by some countries and that has been very effective, particularly good examples? What would be good examples?
Go ahead, Sanjay, please.
Well, I'm sure Jayati has much more to say about it. Let me just suggest first do no harm is the the main principle. And I think that what happened in India, which of course reverberated around the world, was that there was a very untargeted action which harmed quite a number of people without any evident benefit coming from that, as we have seen. Even in advance, it could have been known to some degree that that would be the consequence, because the entire point of the lockdown, even according to theorists of the lockdown, would be to buy time and use that time. And the question is, what did the government have in mind to do during the time that it bought? So I think that the principle of first doing no harm, acting in a very precipitate way, which led to the extraordinary economic and social harms which were encountered, was violated. One would have liked to have anticipated possible consequences, of course, also by having thought through the pathways. It seemed as if many of the consequences were anticipable, were not anticipated, and little was done to address them, certainly with respect to migrant workers, but also in other cases. The WHO does ask countries to prepare pandemic plans, and a number of countries had done so. But most of the pandemic plans were narrowly targeted at influenza and did not consider the spillover effects with respect to other health conditions or indeed economic and social consequences. And I think that more generally, this is an instance of how the disciplinary division of labor can become a problem when governments call on a very small cadre of professionals at best, to prepare something like a pandemic preparedness plan, which really requires attention to those different kinds of spillovers. Now, as to what worked, I think much of the evidence from East Asia suggests essentially high levels of public cooperation with social distancing, support for people who needed quarantining, widespread testing and tracing, public understanding of what exactly was the nature of the disease and why they should act as they should through adequate messaging by the government and other organs. And of course, there's a background of trust which is being drawn upon there. It's not something that necessarily one can bring about overnight. And of course, mask wearing may or may not have had an effect. But a number of things which played an important role possibly in East Asia were slow to be adopted elsewhere, with the emphasis instead being on generalized lockdowns. And if we ask why, well, Neil Ferguson from Imperial College did an agent-based model which focused only on one policy, generalized lockdowns, and that influenced the UK response, it influenced the US response. Those were the two countries he modeled. And it influenced the European response generally. And the Europeans paid little or no attention to what the East Asians were doing. And I think this might be an instance of how Indian policymakers are also overly perhaps attuned to what is the discourse in Western countries and insufficiently attuned to what they can learn from the region, and in this case, Asia.
Jyoti, would you wish to add something?
Yeah, no, I think Sanjay has all, oops, you can hear me now, right? Yes, I think Sanjay has added. I just want to take up on what I thought Atul's very brilliant initial remarks were about, the political economy of this. And I'm wondering whether we are looking at this from the wrong way. We're looking at it from our very old traditional perspective that a government basically wants to do good for the people. Supposing we look for other reasons, just like we should look for other reasons for demonetization rather than the stated reasons. Similarly, let's look for the reasons. I mean, this is a period of widespread public protest in India. This is a period of general upsurge of discontent, etc. At one stroke, you have the ability to just eliminate all of that. You have the ability to declare a national emergency that allows all kinds of measures, which, as we know over the year, were subsequently put in place, including the reforms that Atul was talking about. So maybe just as social scientists, we're doing this wrong. We are not, thinking, what should be governments doing that is good, and why aren't they doing that, and is it incompetence and so on? Or say, well, what's the long-term strategic goal of this particular government, and does it help in meeting those? Unfortunately, apparently it does.
Well, okay. I don't see any other hands up.
Long day for people.
Yeah, it's been a long day. So I think I'll now request Jessim to do the honors as far as the closing of today's program is concerned. Jessim?
Yeah, I'm coming. Yeah. So thank you so much, all the speakers, all the listeners. Even though we started in the afternoon, it's been a long day. It's been a long and very intense afternoon for us. I thank all the speakers of this session, the previous session, and the first session for joining us and making this a very interesting conference. We continue tomorrow, and tomorrow it's at 2 o'clock in the afternoon. Today it was 2:30, so I request all of you to please note that tomorrow we start at 2 o'clock and we go on till about 6:30, I think. Yeah, so we look forward to seeing you all tomorrow in the afternoon.